Oh, we're recorded. All right. So again, welcome everybody to Virginia Virtual Presentation Friday, and we still have a few more people trying to join in. And this is a weekly, supposed to be weekly, presentation every Friday with amazing speakers from all over the country and beyond. And we provide one free CEU to those that attend and those that require them or need them. And that's again, thanks to Virginia Assisted Living Association. And just want to say thank you to you all. We allow this, CEUs are across the country. They are nationally accredited. So if you're in Washington, if you're in California, Texas, if you need these CEUs, they are yours at no charge. So it's a free hour, which I'm really excited to be able to provide to all of you. So feel free to share with your friends, your connections, your networks from all over. It's a great way to network with them because now you're saying, hey, I know this thing, you should join. And now you are growing a stronger connection. And then also following this call, you also get an email, the same email that you'll get the survey. You will also get attendee contact list of everybody that's attending this call today. So there's more networking, more growing, more collaborations building, which is what this group is all about. So again, thank you all for joining us today. Our speaker does not need an introduction. She's an amazing speaker far on the West Coast, probably has better weather than we do, who knows. And Dr. Shula Jaron will be sharing her presentation on infection control surveys with COVID. And I totally butchered that title, but I'm gonna let you take over, Dr. Jaron, and I'm gonna step out of the way and mute myself.
Great, thank you, Micah. And thanks for inviting me again to speak, and thank you all for participating in this call. And I just want to say, Micah, congratulations. I didn't realize that you were having your third. That's very exciting. I know that the life of teenagers in the house, we have 4 teenagers and soon to have a 5th teenager in the house. So I wish you lots of luck with that. So I'm going to tell you a bit about what we've learned over the past year doing surface testing in long-term care and how that's impacting the facilities that we're working with. So just to give you kind of a lay of the land, what we're going to do, first I'm going to tell you a little bit about myself and my company. Then I'm going to just briefly go over some of the things that we already know about COVID, that they may be things that you already know and maybe not. Maybe there's some new information in there. I hope that I can help teach you something. And then I'll go into the data that we've collected over the past year and what that means about surface testing and infection control in long-term care. So as Micah said, my name is Shula Jaron. I am the co-founder and CEO of a company called Envirotech. We are way out on the West Coast. We're in Eugene, Oregon. And what we do is we test buildings for pathogens. And we are focused on infection control in long-term care using surface testing as a way to identify and prevent risk in that facility from outbreaks of that pathogen. We were the first company to offer surface testing as a tool for identifying and detecting COVID within the facility. And I'm really excited to let you know some of the things that we've learned over the last year. So the company itself we're really passionate about environmental testing, specifically for pathogens and specifically for infection control. We really believe that testing is an important part of infection control because it's the tool that actually gives you data and visibility to what's going on in your facility, either before you have an outbreak or after you have an outbreak and you're trying to figure out if your cleaning and disinfecting measures are working appropriately. We also love surface testing. And I'm telling you a lot about surface testing because it is actually a very good non-invasive way to look at groups of people inside your building and provide you a really good view of whether anybody in those groups of people are infected with a pathogen that you should be concerned about. So we use this as a way to determine the risk that you have in your facility for an outbreak. how the surface testing works and how our surface testing works is that, first of all, you have to collect a sample from a surface in your facility, from multiple surfaces, actually. So we don't, our company doesn't actually come into the facility and collect those samples. We actually have created a kit that's super easy to use. We send those kits to facilities. We walk the people in the facility through how they're going to collect samples. It's very simple, fast, easy to use. Those samples get sent back to our labs in Eugene, Oregon, where we test, and within 24 hours, we return a result letting you know whether you have a specific pathogen and how much of that pathogen might be present in your facility. If there's no pathogen present, we can return a certificate letting you and your staff and residents know that you've tested pathogen-free. And most of the facilities that we work with do this as a monitoring. So they do this on a regular basis. They test generally on a weekly basis to kind of keep an eye on what's happening in the facility and let the operators of the facility know how well the infection control measures that they're using are working inside that facility.
It's okay, I'm muted.
So for the past year, we've been primarily focused on COVID. As we all know, COVID has been a critical pathogen for all of our facilities, but also just the world as a whole. In the past year, more than 500,000 people have died within the United States. And we know that even with vaccines coming on rapidly now, that COVID is still going to be a problem, and it's still going to be with us for a long time to come. And so we will have to continue to take measures to keep COVID and all of the other pathogens that we have in our facility under control. And we also know that about 93% of the deaths from COVID in the US were of people over 55. And in fact, about 34% of the deaths were in long-term care. And so this has primarily affected seniors and has really hit the long-term care community extremely hard. And that's why we have been so focused on helping long-term care for the past year. We also know that COVID is airborne. So it is passed primarily through airborne means. So this is a graphical depiction of an outbreak that happened in China in a Chinese restaurant. Colleagues of ours from the University of Oregon studied this outbreak, and they created this graphic to describe what happened in this outbreak. And in this particular outbreak, there was a single person who came into the restaurant who was infected with COVID, and over the course of an evening, managed to infect at least 9 people within that space. And during the study of this space and trying to understand why and how so many people were infected across the room, what they found was that it was primarily due to the air circulation within that room. And the problem for that particular restaurant was that they had very old HVAC system. The airflow in the restaurant was not appropriate. They had no outside air coming in, and they had no filtration on their HVAC system. And so that particular person was able to infect quite a few people because of this poor air circulation. And what does that mean for us? That means that there's some really obvious measures that we can take right away to help us limit the spread of COVID. So it's of course extremely relevant to long-term care because we're dealing with inside environments. So we can modernize our HVAC system. And even if we can't afford right now to modernize an HVAC system, we can use filtration on that HVAC system. We can also simply put in portable HEPA filters. Portable HEPA filters have been found to be very effective in helping to limit the spread of COVID. We can reduce the recirculation of air inside the building. Of course, if you have COVID in the air already and you start to recirculate it, it's going to spread easier. So if we limit the recirculation of air, if we bring more outside air into the building, and then there's some controls around humidity levels. And we know that humidity plays a role in the infectivity of COVID. But these are all measures that we can do right away to help limit the spread within our buildings. So I just described the fact that COVID is transmitted through airborne means. So why do we care about surface testing? So it turns out that surfaces are really great collectors of what's in the air. So if you breathe, if you cough, if you talk, if you cough, of course, those particles get into the air and fairly rapidly fall out of the air onto surfaces in the space around you. And so the surfaces are really great collectors of air particles. And that lets us use surfaces to actually find out what's happening in the air. It also turns out that in a building with a group of people, those surfaces actually collect particles from everybody who's breathing in that space. And so those surfaces can tell us a story of what's going on in the building, who in the building potentially is COVID positive, and where in the building are they moving. So it can tell us a story about what's happening in that building. And then finally, surfaces, I always say that surfaces have memory. And what that means is that if we don't clean surfaces, then we collect particles over time. And so we can actually learn something about everything that's happened between the last cleaning of that surface and now. And so there's some amount of memory that a surface provides us to what has happened over time in that building. So we can look at spatial information, we can look at human information, and we can look at time information from those surfaces. So that's why we've been so interested in collecting samples from surfaces to understand what's going on in long-term care. And we also, you also may ask, well, why test buildings? Why not just test all the people in the buildings? And of course, testing people can be very cost prohibitive. It can be very invasive if you have to collect samples from every person. And if we just look at, and this is another example of an outbreak that happened in a call center in Korea. And in this case, across the bottom, you see time, and across the side, you see the number of cases, confirmed cases. And what happened in that call center, there were hundreds of people coming into this building every single day. But the outbreak started with a single person on February 22nd. That single person was confirmed to be COVID positive. That person infected another person, and those two people went on to infect 45 people within that building. If we had been able to find that needle in the haystack right away, then we could have stopped the outbreak from happening altogether. But in order to find that needle in the haystack, with hundreds of people coming into this building every day, you would have had to test hundreds of people on a very regular basis to find that single person. And so we believe, and we've proven that testing buildings are a really efficient way to help avoid outbreaks within those buildings. So we've been testing buildings actively for, actually it's now a year. And over that year, we've learned a ton. So the way, I mentioned this, the way our testing works is we do what's called monitoring or surveillance testing, where we do regular testing on a weekly basis for for the presence of pathogens. We've been doing that for almost a year for many of our facilities. And we have collected samples from more than 50,000 surfaces across the United States. And we work in every aspect of long-term care and senior care. And what it's given us is really a longitudinal snapshot of what's happening across these facilities across the US. So the first, one of the first things that we wanted to understand, which of the surfaces would be important for us to collect sample from in order to determine whether COVID was present in a building. And you don't have to worry about what this graph on the side says. Just know that there are the two aspects that we're testing here. The first aspect is we're looking for a marker of human cells. And so we're just looking for surfaces in the red that show us a particular marker of human cells. And the reason we look for that is because human cells get everywhere in an environment. And if people are present in an environment, those human cells are all over those surfaces. And so we can detect those human cells on those surfaces. And so we wanted to look at whether there was a correlation between surfaces that had a lot of humanness to them and surfaces where we could easily detect COVID. And we found that there's a strong correlation between the surfaces that have a lot of humanness and the surfaces where we detect COVID. And so that was the first thing, is it really tells us that in high traffic areas, those are the areas that we want to focus on, the places where people are present. Not a big surprise, right? And then the other piece of this is that we found that the higher the level of COVID that we're detecting on a surface, the more likely it is that you have a recent active shedder in that environment. And so those were two pieces of information that we were able to take away from this part of our study, was to say, okay, we need to focus for sure in high traffic areas, and that the more COVID we detect, the more likely it is that there's an active shedder in that environment. We also discovered that COVID particles can remain on surfaces for many days. And so I don't want to, I want to make sure that I'm very clear about this. It does not mean that COVID is infectious. It just means that we can detect that it was there over a long period of time. And that's where we're starting to get that memory. We're starting to say, okay, was this somebody who is present today, or is this somebody who was present a few days ago? And so we can start to look at sort of the memory of those surfaces. We also wanted to understand how many surfaces did we need to collect sample from in order to be certain that if COVID was present, we were able to detect it. And what we found was that if we collected sample from a single surface in a facility, we had about a 25% chance of detecting COVID if it was present. And that probability of detecting COVID if it was present increases the more surfaces that you collect samples from. And those surfaces have to be distinct from each other. So that means that they cannot be connected. You don't collect sample from the doorknob and then the door itself, because those are connected surfaces. We look for independent surfaces. And what we found was that if we collected samples from about 8 surfaces, we had about 90% chance of detecting COVID if it was present in a facility. So that started to tell us exactly how we needed to go about collecting samples. So we wanted to focus in high traffic areas and focus on those surfaces in about 8 surfaces in those high traffic areas, so that we had the highest probability of detecting COVID without spending a lot of time and money to collect samples from lots and lots of surfaces. We wanted to make it efficient. And what we found is that testing has, that the companies that we've been working with really were struggling because they were not able to, they had no way to know that they were going to have an outbreak until an outbreak happened. And so we have, they have inserted testing as part of their overall infection control protocol so that they can start to get some visibility to what's going on before an outbreak happens, so they can stop that outbreak from happening. And I'm going to describe some of the data that we have there. So they've been using it for surveillance for new infections, surveillance so that they can predict a new infection, as well as confirmation that their infection control measures are working inside that facility. And then the third reason is that it's really given these companies, the staff and the residents and the families of the residents, peace of mind, knowing that there's data that is supporting the decisions that they're making within the facilities. So the first, so one of the things that we've done is that as I've said, we've collected this surveillance data over a long period of time. And what we've done is we've overlaid the positivity rate of the surfaces with the positivity rate of new human infections that's being collected by the CDC. And so what you see here are two graphs. The bottom axis is just the time. It's just, these are week numbers. So the week numbers during 2020, and now week numbers into 2021. And then on the left-hand side is the positivity rate in those samples that were collected. And this is, the blue line are the surface samples, the positivity rate of the surface samples, and in the red line is the positivity rate of from the CDC of the human samples. And this is, just to be clear, this is taking all of the samples that we've collected across the United States and averaging them, so that this is a picture of the entire US, not a single facility in this. And so at a very macro level, when we look at the positivity rate that we're measuring from surfaces across the US, what we see is that we start to see an increase in positivity rate about 2 weeks before there's a reported increase from the CDC. And that's happened time and time again. So this first hump here is back in the July-August timeframe of last year. We see another increase back here, which is in the September-October timeframe. And then we're starting to see we started to see an increase in the February timeframe. And now we're starting to see an increase overall in the CDC data, which I haven't plotted out far enough here so that you can see it. And so at a macro level, we see about a 2-week heads up that there's going to be a spike in the positivity rate. And if we look at it at a micro level, if we look at it at an individual facility, we see something very similar. This is an example of testing that we have been doing in a particular facility. This particular facility had been negative for many weeks. So those green bars that you see are all the negative results. And then bam, all of a sudden they're starting to see red. And that's an indication that there was a positive surface sample in that facility. And that facility at that time did not know that they had any positive people within that facility. They used that information that they had positive surfaces to turn around and start testing people. And they identified 2 staff members who were positive. They were able to isolate, and they were positive, but asymptomatic. And so they were able to isolate, remove those staff members from the facility. And then within a week, both of those staff members became symptomatic. So had they not had that early indication that there was somebody in their facility, likely those staff members would have continued to come to work. They would have continued to shed virus, and other people would have started to become sick. But in this case, they were able to prevent a further outbreak in that facility by having that early warning sign. And so you can imagine, if we look back at our example of the facility in Korea, again, had we had that early warning sign before the first person came in and infected other people, we could have probably stopped it right there. And even if we had had an early warning, just a couple of days early warning about the second person, we probably could have stopped the full 45 from becoming infected. So having that early detection, that surveillance is so important to stopping further outbreaks. So however surveillance is going to be done, doing some amount of surveillance is super important. So for the facilities that we've been working with, that surface testing has provided that first indication that they have an infected person in that facility. It's given them some amount of ability to contact trace because they can look at which surface it is that is positive and identify the people that would have come in contact with that surface. And then they take that information to identify what the follow-on steps are. Typically, that's additional testing to identify any additional cases that need to be isolated. So the second area where the facilities that we're working with have really found effectiveness is really understanding how their cleaning and disinfecting processes are working. And so they're using that surface testing in addition to doing the surveillance. They're using it to really confirm whether housekeeping is doing the job that they're supposed to and whether they've chosen the right tools for the job. So this is, so the graph here is a graph that, don't worry about what's on it, but the purpose is that we have been looking at different disinfectants and cleaners to understand which disinfectants and cleaners are the most effective at removing COVID or other pathogens. We're just about now to launch a kit for norovirus. So we're also looking at what disinfectants and cleaners are the most effective for norovirus. It's extremely important for norovirus, of course, to remove particles from surfaces so that there is no further spread. But what I'm showing you here is that this data that doing the testing has really helped to identify where we should be focusing our cleaning and disinfecting. And in this case for COVID, what we found was that the best tool to use to remove particles from surfaces is bleach. Not a surprise, but not what we all want to hear. We prefer not to use bleach if possible. We still have ongoing testing looking for a cleaner and disinfectant that can be an alternative to bleach, a safer alternative to bleach. Really a big part of this that we found is that you need to use the appropriate cleaning practices to remove the virus. And if you, dwell time is super important. If you don't follow those EPA guidelines for how much, how long, then you're really not going to be as effective in doing the cleaning and disinfecting. Wiping is essential to remove the virus. So we've worked with a lot of foggers, which may in fact kill the virus, but if you want to remove stuff from surfaces that you actually have to wipe them to get everything off of that surface. And then, as I said, we're looking for bleach alternatives so that we don't have to use harsh chemicals on the surfaces that in our facilities. And then finally, the testing, what we found is that testing has really given people peace of mind. I field a lot of emails and phone calls from the staff of the facilities that we work in, who are always super happy and super excited to know when they've gotten a test result back. And so of course, when we get a negative test result, everybody is really thrilled because it means that the measures that they're taking are working and they're not, there's no fear of having another outbreak. But even a positive result has been really useful because it gives people a thing to do next. It tells them, okay, I have a problem, now I can take action. Whereas before they were just waiting to find out if there was a problem. So as I said at the very beginning, COVID has been a wake-up call. It's going to be with us for a long time. We know now that there are more variants of COVID that are coming. They look like they are more transmissible. We're starting to see another increase in COVID cases across the country. It's not time to let down our guard. We need to continue to be vigilant. We need to continue to use the practices that we've learned over the last year that have been really effective at both protecting us from COVID, but protecting us from lots of other pathogens. The incidence of influenza and norovirus are down, and that is primarily due to the fact that we're taking these all of these precautionary measures for COVID, which are having a ripple-on effect for these other pathogens. So we need to really look at that and take note and think about what are we going to continue to do even once everybody is fully vaccinated. How are we going to continue to keep people healthy and safe? Testing is, of course, really useful in giving you visibility to what's going on. We are big proponents, of course, of environmental testing, of surface testing, but any type of testing, anything that you can do to collect data to know whether the measures that you're taking are effective is super important, super useful, and gives you visibility to what's going on that you just don't have any other way. What this means for you is really, I think I just said this already, like continue to have a good infection control protocol. Really, there's going to be a lot of talk about how do we create and maintain a culture in our facilities that encourages strong infection prevention measures. Have that protocol in place. There's a lot of different parts that need to be taken into account: hygiene, screening, testing, PPE, and really, like, culture is, I think, a linchpin here, is making sure that the culture in our facilities embraces good infection prevention. And of course, I'll just repeat this again: data, make decisions based on data. So what are we doing? So our company, what we're doing beyond COVID is we are now broadening out our panel to provide a broad surveillance panel for environmental testing. We've already started testing for influenza and norovirus. We're also going to be adding on other intestinal pathogens, and we'll always be looking for new emerging pathogens, new emerging viruses that need to be tested for. So we're here to help you, to provide you with a broad surveillance testing platform if you need it. And then before I, let's see, I think that, yeah. So before I leave you, there is some data that is sort of emerging that we've just started to really look at in our data set. And one thing that's kind of interesting, and it's so new that I wasn't able to really put it into this presentation today, is that we've been looking at, if you test positive in your facility, what is the next most important date in that facility for knowing how well your infection prevention measures are working. And what we've found is that if you have a facility that has been negative, and this is specifically for COVID, if you've had a facility that's been negative and you have a positive, that the next most important date, it looks like, is about 2 weeks out. Because what should happen within 2 weeks is that you should go back to being negative. You should have isolated your person, and then we should be able to see that the cleaning measures are now taking care of the COVID in the environment. If in 2 weeks, we're continuing to detect positive samples on surfaces, what it looks like is that means that you're going to have a persistent problem in that facility. And my conclusion there is that means that you really need to look at your infection prevention measures and make sure that everything that you've put in place is still working and still being actively performed. So just a little thing that we've noticed, and that hopefully the next time I give this presentation, I'll be able to show some of that data in graphical format. So if you'd like to learn more, I'm more than happy to take questions now. I've put my email address up here. You can email me directly. I'm happy to answer any of your questions, either in person live now or by email later. So thank you.
Thank you, Dr. Jaron. If you could stop sharing.
Yep, I think I can.
There it goes. So I know I have at least 3 questions. So while everybody's trying to think about their questions, because this was some good information and it's kind of mind-blowing on the information they have been studying and doing since the pandemic. So one of the questions that I had was from somebody was, any advice or information on products that direct care professionals can purchase for infection control in their own homes that may be less expensive substitutes for those in facilities?
That's a really good question. And I don't have that information off the top of my head, but I would be happy to go back and talk to my team and see what recommendations they have. Okay. So if that person wants to send me an email or shoot their email address in the chat, then I can certainly follow up.
Okay, thank you. And 2 other questions that also came through the chat. If you had found COVID in that building, the building you initially alluded to, would you then test every person in that building to find out who was the infected staff member?
So that's really dependent on where we find the COVID. And so so typically when we work with a facility, what we try to do is to create pods, essentially. So we're looking at surfaces, and then we know what the pod of people are that would have had interaction with that surface. So sometimes we also test in like broad general areas where, like an entryway where everybody comes through. But if we can, we try to do a little bit of contact tracing by isolating the location so that we can really identify the group of people. So we're not having to test everybody in the facility.
Got it. Audra, I believe that was your question. If you want to elaborate or if that was answered, please let me know either in the chat or live. Next question was, do you test other locations such as hotels, business offices, and churches? That every time, this is the second time she's done this presentation, and it seems like people go, planes even was another question that somebody asked at the last one. So do you do other locations?
We do. So our team is very, very focused in long-term care, although we do also test in other places. So we test in school systems, we test in big corporations, in like distribution centers. We haven't done churches yet, but it would be similar. The churches are nice because it's a group of people, who's in the building. And that's kind of the critical piece, is that you want to have, when we do any kind of environmental testing, we want to know what our plan is for what we do when we have a positive test. And so if you can isolate a group of people and know that you're essentially testing that group of people without doing individual tests on each of them, then that gives you an information about the group. Then you can take that next step if you find a positive.
Awesome. I hope that answers your question. One other person commented, really interesting. I'm going to share the recording with my director of housekeeping ASAP, which is really exciting. But they also had a question, any testing available for private residents?
So we do sell our kits individually. Typically the way our like I said, the way our business works is that we work really closely with our long-term care customers to make sure that they're getting a complete system in place. We do actually sell kits off our website if people want to test in their homes, and we have tested quite a few homes over the past year as well.
Okay. Another question was, so actually wiping down, oh, somebody else commented, so okay. So actually wiping down surfaces rather than just spraying is more effective?
So you need to do both. So you spray the surface and then wipe it down. So if you just spray without doing the manual wiping, then you may kill what's on the surface, but you won't remove anything. It's just like, if you had dirt on the surface, right? If you need to remove the dirt, you have to actually manually remove it.
Okay. So that's the questions in the chat. Does anybody feel bold enough to actually ask a question live? Does anybody have any questions at all for Dr. Jaron? I mean, you do have an expert here. So even though she may not see herself as an expert, but I do. So do you have any other questions for her at all? Come on, everybody. You're in your communities. This is good information. Okay. So my question to keep going is when you're doing these testings, I think you mentioned some chemicals that are better used than others. Is there any other options that they can use for the communities?
So right now we still are, bleach is still kind of the best alternative. As more information emerges, we'll be publishing that on our website. But unfortunately right now, I don't have anything that's fantastic. Yeah.
Fair enough.
Other fantastic news. So,
okay. Does anybody have any other questions for Dr. Jaron? Okay, well, fine. Well, to answer a question in the chat, let me do this. I'm gonna stop recording because usually that means that people will ask more questions.